morning. We encourage everyone to settle down, and for those in Zoom, get yourselves comfortable as we will begin the program in a Professor Regine, and I am thrilled to be part of this morning's program as your host. Welcome to this month's LTIO on monkeypox or Mpox, Uncovered Safeguarding Health, Preventing Outbreaks. So this insightful lecture is proudly brought to you by the UPOU Faculty of Management and Development Studies, hosted by the Diploma in Master of International Health. This discussion aims to enhance awareness and preparedness against Mpox, as well as equip the participants with the knowledge and skills necessary to contribute to its prevention and control efforts. The ultimate goal is to safeguard public health efforts by ensuring that healthcare systems and individuals are informed and ready to address future outbreaks effectively. So we are coming to you live from the UPOU audiovisual room and are also streaming online via the UPOU Network's website, Facebook page, and the YouTube channel. This event supports several Sustainable Development Goals, SDGs, including good health and well-being, SDG 3, quality education, SDG 4, and partnerships for the goal, SDG 17. This also aligns with our mission to integrate public service, research, and instruction embodied in our initiative, Community Inclusivity, Digital Transformation, and Acceleration Towards Sustainability, or SIDAS. And now to officially welcome everyone to today's event, let me give the floor to our Dean, Professor Joanne V. Serrano.
Maraming salamat, Reg. Isang maalab at mapagpalayang araw sa ating lahat. Before I begin, allow me to warmly greet our distinguished speaker, Dr. Arthur Desi Roman. It's a privilege to welcome each one of you and to officially open today's session in the Let's Talk It Over or LTIO series titled Mpox, Uncovered, Safeguarding Health, Preventing Outbreaks. And I would like to thank also the Research Institute for Tropical Medicine or RITM in Alabang, Muntinlupa City for also collaborating. Now, for those joining the LTIO series for the first time, this platform is dedicated to sharing knowledge and engaging with our community, demonstrating our faculty's commitment to making education open and accessible to all. The Faculty of Management Development Studies covers a range of fields from health and environmental management to public service and entrepreneurship, all focused on addressing issues that directly impact people's lives. And we hope that through this LTIO, we are able to bridge the gap between knowledge and those seeking it through this hybrid format that allows both in-person and virtual communities to come together in meaningful discussions no matter where they are. And of course, we are always having the UN Sustainable Goals as our part of our theme. And we hope that we'll be able to empower FMDS students and the broader public to contribute to these global goals. Now, today's webinar on Mpox is very timely and crucial. So it has become a significant public health issues in recent years. In fact, lagi tayong natatakot, di ba, pag merong case na daw, malapit na, mga balita, hindi natin sure. Pero lagi tayong may kaba at takot kung malapit na ba dito sa Los Baños or meron na ba tayong mga kakilala na meron na nitong Mpox. And there have been cases appearing in parts of the world where it had never been seen before. So we have seen news, di ba, dito sa Pilipinas na may various cases. Hindi ko rin alam kung totoo, but I hope malinawan tayo kung ano na ba ang estado nito. This viral disease can really cause serious health concerns, especially among vulnerable groups. And it demand quick action and collaboration to prevent its spread. So, kaya napaka-importante nitong mga gantong LTIO in session because we hope that through this webinar, it will be able to provide key insights on various aspects about Mpox. For example, ano ba tong Mpox na to? Saan ba to galing? Dapat ba tayo mag-pay attention dito o parang katulad lang to ng mga dumadaan na sakit o ito ba ay may posibleng maging katulad nung recent pandemic? So kailangan nating maintindihan to. Paano ba ito nag-spread? Ano ba ang contributory factor kung ito ay magkakaroon ng outbreak? Ano ba yung mga symptoms na dapat nating tingnan? Yung bang katabi natin na may mga bilog-bilog sa katawan. Ito ba'y Mpox na? So, yung mga bagay na kailangan nating maging informed. So, I hope maintindihan natin at kung paano ba tayo ma-protect, how can we protect ourselves, our families, and our communities. And of course, ano ba ang mga possible public health campaigns? At ano ba, meron bang vaccine para matulungan ito? So itong mga katanungan na to ang ating hopefully masagot ngayong webinar. We hope that through this webinar, you'll be able to be empowered with the knowledge and skills para naman maintindihan natin ito, ma-share natin sa ating mga kapamilya at sa ating mga komunidad. At yung mga estudyante ng FMDS will be able to make informed decisions, lalo na sa pag-share nitong mga information na to sa kanilang mga respective circles and communities. So yun lamang po, maraming salamat and I'm hoping to have a productive and very insightful webinar. Maraming salamat po.
Yes, thank you very much, Dean. Actually, we in UHS almost experienced this Mpox, and it's really tawag dito, nakakatakot when you don't know anything about it. So before we begin our lecture this morning, may we kindly remind our attendees, please feel free to start preparing your questions as you listen to the presentation. On-site participants can write their questions on the provided paper and hand it to any of our facilitators in those who are wearing maroon, stationed at the back. So you may also ask your question directly during the open forum. For our online participants, please post your questions in the comment or chat box on your streaming platform. For our attendees here at AVR, please be mindful of the cameras as we are live streaming this morning's event. So lastly, please remember to practice proper waste segregation. Refreshments and snacks are available to your right, while the restrooms are located outside to your left. So that is our for our reminders. Now it's my pleasure to introduce to you our speaker for today. Dr. Arthur Desi Roman is an esteemed internist, infectious disease, and tropical medicine specialist with extensive experience in infectious disease management and public health. Currently serving as the Vice President of the Philippine Society for Microbiology and Infectious Disease. He plays a vital role in advancing infectious disease research and education in the Philippines. Dr. Roman is also a respected figure in hospital infection control, having led as the past President of the Philippine Hospital Infection Control Society. In this role, as Officer in Charge and Medical Specialist at the Medical Department of the Research Institute for Tropical Medicine, he contributes significantly to national research efforts, addressing critical tropical and emerging infections. As a clinical associate professor at the UP Philippine General Hospital Department of Medicine, Dr. Roman imparts his expertise to future medical professionals. He holds the distinction of diplomate and fellow with the Philippine College of Physicians, or PCP, and serves as the Vice President of PCP's Manila chapter. In addition, his active membership in the Department of Health's Strategic Advisory Group of Experts on Emerging and Re-emerging Infectious Disease highlights his commitment to guiding public health responses and strategies. Dr. Roman's dedication to infectious disease management underscores his pivotal role in both clinical and policymaking arenas in the Philippines. Let's all welcome Dr. Arthur Desi Roman.
Hello, magandang umaga po sa atin. Thank you for that wonderful introduction, Doc. Doc Des po yung tawag nila sa akin, and I hope you can see my screen now, Doc. If you can, Prof, if you can confirm.
Hello? Yes po, Doc.
Yeah, okay. So we'll be talking about Mpox. We'll be uncovering Mpox, and we'll try to safeguard our health and prevent outbreaks in the future. But as Dean was trying to talk about earlier, sabi niya doon, what is the difference probably of this outbreak from the other outbreaks? So let me just emphasize that monkeypox or Mpox right now is different from COVID-19 in several ways. They are caused by different viruses. Di ba yung COVID-19, it's caused by your SARS-CoV virus. It's basically a respiratory virus. It affects the respiratory system. Pero ang monkeypox virus that causes Mpox, the disease, it basically affects the skin. They present differently. So magkaiba yung signs and symptoms nila, and slightly there's a difference in the mode of transmission because of course you know that respiratory and airborne is the mode of transmission ng COVID-19, pero ang Mpox, it's really close physical contact. But the good news is both of them can be effectively prevented by our minimum public health standards that we learned from COVID-19. Ano yun? Yung paggamit ng mask, physical distancing, hand hygiene, and later on I will discuss additional strategies on how we are able to prevent Mpox. So let me start by, I know you have attended a lot of Mpox webinars already. Yung Mpox is formerly called monkeypox, pero you know that we are trying to gear away from using places or animals in association with disease. So we'll be using Mpox from now on. It's a rare zoonotic disease. And when you say zoonotic disease, ang ibig sabihin nun ay it originated from animals, so the primary infection is coming from animals, and later on it can be transmitted to humans. So from animal to humans, that's your primary infection, and then subsequently there can be human to human transmission, which are secondary infections. To some extent there can be mother to fetus transmission, and sometimes consumption of contaminated animal products. But your Mpox really affects the skin, di ba? It's very visible. Kaya nga medyo alarming kapag nakakita tayo ng cases ng Mpox when we do a Google search in the internet. Mpox is a zoonotic disease. It's endemic to Central and Western Africa, and it is most concentrated in the Democratic Republic of Congo, particularly this ongoing outbreak. And as I've said earlier, rodents, particularly your African rodents, are the natural reservoir. That's where the infection is coming from. Now, there are several stages ng monkeypox. So it starts with the incubation period. So when you say incubation period, it's the time that you get exposed and infected by the virus until the time that you develop your signs and symptoms. So medyo mahaba yung incubation period ng Mpox. It can take somewhere from 5 to 21 days. Basically, when you say incubation period, there is no symptoms. And then the first symptom that you might experience would be fever. So you can have fever, you can have namamagay yung mga kulane, swollen lymph nodes, there can be headache and chills. And this fever stage is very short-lived. It's just 1 to 4 days. And some patients, very mild lang yung lagnat. And actually, in some patients, wala silang ma-recall na lagnat. Just some malaise and, a feeling of not being well. And then this is going to be followed by your rash stage. Later on, I will show you a lot of pictures of the rash. And then, of course, after usually 21 days to 4 weeks, then the patient will recover already. The lesions in the skin will start to heal and disappear. When you Google your monkeypox before 2022, for example, ito po yung mga pictures na lalabas dun sa inyong Google search, di ba? It's very systemic, it's very generalized, it's pretty devastating, and medyo nakakatakot talaga yung itsura niya, di ba? So initially, the lesions will start out as fluid filled, minsan pus filled. So parang merong kulay na laman yung bootleg, and eventually it will have a pustule. It will become a pustule, and magkakaroon siya ng umbilication in the middle. So when you say umbilication, yung parang siyang may tuldok sa gitna, as you can see here, and it will disseminate to involve all parts of the body. Now, I would like us to differentiate several types of Mpox. Okay? So yung monkeypox virus natin, meron siyang dalawang distinctive types or clades. Alright? So meron tayong clade 1 tsaka meron tayong clade 2. So when you say clade 1, this is the original clade that we know. It originated from the Central Africa, and there are subclads 1A and 1B. And when you say clade 1, ito yung mas severe yung disease, mas malala, mas marami yung lesions, and it has a higher mortality rate up to 10%. And just try to take a look at the lesions, di ba? So mas marami talaga siya, mas malalaki. And try to look at the lesions of your clade 2, di ba? It's smaller, but it's very umbilicated. Ibig sabihin, meron talagang scab or merong tuldok doon sa gitna. So yung clade 2 naman, this is formerly called your West African clade. Also, there are two subclads, subclade 2A and 2B. And ito yung predominant clade in the 2022 outbreak. So, i-differentiate natin yung 2022 outbreak ng Mpox tsaka yung 2024 outbreak ng Mpox. The good news about your clade 2 is that it ranges from 1 to 3%, 3.6% mortality only. So, mas mababa yung mortality rate ng clade 2. So, let's go back in time. Hindi kasi this year yung first time na nagkaroon ng Mpox na outbreak. Back in 2022, meron na talagang nagkaroon ng outbreak in Africa, in the American countries, and also in the European countries. So in that particular outbreak, clade 2 yung naging primary clade niya. So it has been caused by clade 2. So most of the cases back then in 2022, very mild talaga yung cases. Ano lang siya, solitary, pa isa-isa lang siya. And hindi siya yung as generalized as what has been reported in the past, in the 1980s, in the 1990s, and in other outbreaks earlier than 2022. Ngayon, yung mga cases that started, actually December of 2023 pa siya, but it peaked sometime in August of 2024, this one, okay? The general clade that has been identified is clade 1B, but this is located or concentrated in the African region, particularly in the Democratic Republic of Congo. And because of this increase in the number of cases in the Democratic Republic of Congo, in some cases that are imported to other countries, the World Health Organization Director General declared this Mpox to be an outbreak of public health emergency, or an outbreak or a public health emergency of international concern. So, let's focus on the 2024 outbreak. So this began in Central Africa, September of 2023 pa, December of 2023 pa. Over 21,000 cases have been reported in 13 African Union member states, but particularly, ang dami talaga ng cases came from the Democratic Republic of Congo. And the identified death rate or case fatality rate is around 2.9%. And several countries have reported their first cases surrounding the Democratic Republic of Congo, Rwanda, Uganda, Ivory Coast, Burundi, and the confirmed Mpox cases was due to either subclade 1A or 1B, and there have been reported in, as I've said, in other countries. Ngayon, what information do we know about the 2024 Mpox PHEIC? There have been identified multiple modes of transmission. Of course, there's sexual transmission, household transmission, but in general, all of these types of transmission would involve close physical contact. It's not necessarily sexually transmitted, but because when you perform sexual activities, it will really require close physical contact. So indirectly, sexual transmission is linked to a close physical contact. It can lead to a sustained community transmission in the absence of zoonotic transmission. And in the Democratic Republic of Congo, 1A yung circulating. Okay? So therefore, kung 1A yung circulating niya, then it's going to be more severe than your clade 2, which was the predominantly circulating clade globally back in 2022. So how about in the Philippines? So far, have we had more cases since August or September of this year when we reported the first 8 cases? Actually, may dumadagdag sa number of confirmed cases. Right now, we're at 33. And so far, all of them are still clad 2 cases. So, ano ang sinasabi nito? Ang sinasabi nito, yung cases natin ngayon are probably, they are still overflow of the cases that happened noong 2022. And these are not cases that came from the ongoing outbreak of Clade 1 Mpox sa Democratic Republic of Congo at this time. Okay, so I hope you realize that difference. So right now, here in the Philippines, all of our cases are still Clade 2 cases. Okay, so meaning they are mild. And I will show you kung ano po yung mga classic na presentation ng Mpox na nakikita natin here. So this is an example of actual pictures ng cases natin. So kung mapapansin nyo, para siyang pimples talaga. These are pustules. They are pus-filled na vesicles na mayroong butlig sa gitna. Okay? Tapos hindi siya ganun karami, di ba? So these are examples of lesions in the body. And here, mayroon siyang lesion inside the mouth. Okay? Other pictures, very similar. This one is on the lips. Okay? Ito, sa tuhod po yan. So, very classic yung pustule na mayroong butlig sa gitna. And then, these are pictures 14 days from the onset. So, kung mapapansin nyo, after 2 weeks or 14 days, nagpa-flatten na yung lesion, tapos naglalangib na yung butlig sa gitna. And then, after another week, by day 21, ayan, the scabs will fall off. And then, when all of the scabs have fallen off and it will reveal the healed skin, then this is the time that the patient is considered to be non-infectious already. So all in all, ang tinatayang transmissibility or infectiousness period ng Mpox would be 21 days. So I was talking about the transmission of Mpox. It's really close physical contact. So it can be skin-to-skin contact, it can be mouth-to-skin, or even face-to-face contact. Yung mga activities involved in the performance of sex. So ibig sabihin, when you perform sex, even without genital penetration, that puts you at risk because it will require close physical contact. But take note that even non-sexual activities that will require prolonged contact time, especially in areas with high reported cases of Mpox, that can still be a risk factor for acquisition and transmission of Mpox. Yung exposure to the respiratory secretions, kasi di ba ito yung main mode of transmission ng COVID-19, in Mpox, while there have been research studies that document the isolation of the monkeypox virus in the respiratory secretions, up to this time, hindi pa natin alam kung gaano ka-important clinically or what is its public health role in terms of transmission. But within the healthcare facility, for example, when we at the hospital at RITM, when we take care of Mpox confirmed cases or even suspected cases, we ensure that we are protected by wearing the complete set of personal protective equipment. Yung treatment ng Mpox at this time, it's still supportive. Yung antivirals that we've heard of, ang approval niyan actually would be for smallpox. But these drugs, yung tecovirimat, for example, has been repurposed for the treatment of Mpox, and there has been recently a publication that would show that in fact, meron namang benefit yung paggamit ng TPOXX or tecovirimat for Mpox patients na malala yung sakit. So for Mpox patients with severe disease or those who are severely immunocompromised. But basically, the cornerstone of management, of treatment ng Mpox would still be supportive. Ibig sabihin, when the patient is unable to eat because there are a lot of lesions inside the mouth, then you would have to start this patient on intravenous fluids, lalagyan ng suero. When the lesions are really painful, the lesions are inside the mouth or in the anal area, and the patient has difficulty defecating kasi nga masakit, then you can give stool softeners and analgesics or pain medications. It's very important talaga to prevent the infection. But when you have the lesions already, you don't manipulate it. You try to keep it clean and dry because you want to prevent bacteria from infecting it. So you always monitor these patients for the development of the disease. I was talking about tecovirimat or TPAX initially for smallpox, but this has been approved by the US FDA for the treatment of Mpox. Here in the Philippines, we are in the process of procuring it already. So the target is by the end of December, we should have our tecovirimat stocks already. Yung other components ng supportive care would be wound care of the lesion. So you just clean it with plain NSS and then apply petroleum jelly dun sa crust, dun sa langib. When the patient has abdominal pain, then you start this patient on IV fluids and replace yung potassium and sodium in case the patient is unable to take in food. Kung nagsusuka, we give anti-pagsusuka or antiemetics, and we can give mouthwashes for the oral lesions. Okay. So, yung available vaccines, here is a list of the candidate vaccines, but none of these are available yet. Again, similar to the acquisition of TPAX, talks are on the way to bring this Mpox vaccines here in the Philippines. But I would just like to emphasize here that when these vaccines become available, this is not going to be rolled out to the general population right away. So, there are specific population na kailangang makatanggap or indicated yung Mpox vaccination, and whenever or when the time comes that there will be a rollout, so parang similar siya dun sa COVID-19 vaccine when we initially did it. So there will be group A, group B, and that will depend on the risk of this group of population, kaya ipaprioritize sila to receiving the Mpox vaccine. So right now, I will proceed to the prevention strategies already, because you know that for viral infections na hindi pa ganun kataas yung evidence for treatment, really, it's prevention that we want to emphasize on. So for everyone in the community, we want you to practice respiratory etiquette. And this is not just true for COVID-19, also for the prevention of Mpox, especially when we are in crowded areas. Pag umuubo, magtakip ng bibig, or better yet, when you are symptomatic, you wear your mask. So that's a well-fitted surgical mask. You don't need your N95 in the community. In the hospitals, we use N95. We always perform hand hygiene, and we always clean and disinfect yung mga objects that can be disinfected with our usual na alcohol, yung mga 70% alcohol natin, or yung mga usual natin na hand sanitizer. Those are effective in inactivating the Mpox virus. So, there are different activities, and we can risk stratify these activities in terms of transmitting Mpox into activities that pose relatively lower risk, activities that will pose some risk, and activities that are actually high risk para maka-acquire ka ng Mpox. So yung mga relatively lower risk, actually low risk talaga, would be the following: yung mga paggamit ng crowded public transports, yung attending festivals, concerts, and events where the attendees are actually fully clothed naman, and contact with high-touch surfaces, because actually medyo mabilis naman ma-inactivate ang Mpox virus. Swimming pool, hot tub, or body of water, yung pag-grocery and airports and touching the grocery carts, yung co-worker to co-worker transmission, this is really low risk. So for when you intend to engage in these activities, you just have to be mindful of doing other high-risk activities such as kissing that might spread Mpox. And what you want to do is you just want to disinfect the surfaces frequently, wear a mask kung ganito ka-crowded, if possible, kung hindi ganun kainit, you might want to wear yung mga long sleeves clothing, and pagdating nyo sa bahay, kung masyado talagang siksikan and hindi talaga ma-avoid yung contact with other skin surfaces, maligo agad. Or pagkababa ng LRT, for example, mag-disinfect ka agad using your hand sanitizer or yung alcohol. Yung mga activities naman that will pose some risk, ito, yung going to rave parties, club where there is minimal clothing, and when there is direct, personal, often skin-to-skin contact. You know naman kasi when there's alcohol, for example, kapag gumigimik, you're a little bit more a little bit more uninhibited. Yan. Oh, and you might perform some higher risk activities. Of course, in terms of personal items, we usually don't share personal items naman, di ba? But of course, in some clubs, for example, some people, kapag lasing na, they will share drinks and cigarettes, sharing bed, towels, and other personal items. So for these types of activities, as much as possible, you avoid. Kung hindi talaga, avoid any rash that you see on others and minimize skin-to-skin contact. There are really high-risk activities at this time, yung mga engaging in private and public sex parties where intimate, often anonymous sexual contact with multiple partners have been reported, yung mga enclosed spaces, saunas, massage parlors, and sex clubs, and other procedures that will involve personal, intimate contact. What do we recommend at this time? Siyempre, the only way to really get a 0% risk of getting Mpox is to avoid these types of activities. Of course, there are mitigating measures para mapababa yung risk whenever we engage in these types of activities, but only when we do not engage in such activities or we do not go in these places do we get 0% risk. Now, syempre, medyo ano yan eh, instincts talaga yan. Sexual instinct is very natural among humans, di ba? So if intimate contact is really inevitable, we can practice mitigating measures. So example niyan is having sex with your clothes on or covering areas kung present man yung rash, and reducing as much skin-to-skin contact as possible. But always, we tell our patients, whenever you have rash, consult your physician para malaman kung ano ba yung diagnosis for the rash, and in case it's Mpox, you can be advised properly, and you can be directed where to go. If the rash is confined to the genital area, dun sa may are, or the anal area sa may puwetan, condoms may be helpful, but just take note that the use of condoms alone are not likely enough to prevent Mpox. Kasi nga, even without genital penetration, as long as there's close physical contact, there can be transmission of Mpox. Avoid kissing and do not touch the rash. And kung pwede sana at this time, you can consider remote sex only. So, pwedeng ang tawag natin diyan, 'di ba, sa usual slang term yung VJAX muna. So, remote masturbation muna. You try to use fetish gears, and you stay away from one another at this time, and remember to wash these implements and wash your hands after having sex. So, a few more reminders. Okay, so when you talk about Mpox, you just have to be aware. By attending this webinar, I have told you about the transmission and current state, and even the disease presentation of Mpox. So remember that Mpox is a viral illness. It's caused by your monkeypox virus that present with umbilicated pustules. So para siyang pimples na mayroong butlik sa gitna, and this is transmitted via close physical contact. And yung presentation ng Mpox cases, particularly caused by Clade 2. Again, dito sa Pilipinas, puro pa rin tayo Clade 2 at this time. So we expect na generally mild pa rin yung presentation. Ang ayaw nating mangyari, kaya tayo maingat, is for the Clade 1b circulating in other portions of Africa na may severe yung presentation na makarating dito sa Pilipinas. Because your Clade 1b mas severe yung presentation, and that is not something that we want to enter in the Philippines. The Mpox major transmission risk is really close physical contact. So this is with or without sexual contact or with or without genital penetration, but it can also include non-sexual contact as long as there's close, intimate physical contact involved. Okay. So some other things on how to prevent Mpox, because we want to be responsible, di ba? After being aware, we want to be responsible by trying to avoid getting infected by Mpox. But at the same time, we don't want to transfer Mpox to others. So we want to minimize the risk of getting and transmitting Mpox by wearing masks, cleaning your surfaces, and generally, ano siya, it's personal hygiene, improving personal hygiene. So precautions for Mpox include standard contact and respiratory precautions within the hospital setting. But in my previous slides, diba, I have discussed the best ways to minimize the risk of Mpox in the community. So kami sa hospital, ito yung complete set of personal protective equipment namin. And as I've emphasized earlier, for people in the community, consult for any unexpected rash with or without fever so that you can be assessed early on. And if it is indeed Mpox, and even if it's not Mpox kasi, halimbawa kahit na chickenpox siya, you still know that chickenpox is highly transmissible. So it's best for you to consult so you can be advised properly. So part of being responsible is preparation as well. So preparation for every institution. So whether you are a hospital, a school, for example, a bank, you should always prepare for your first Mpox case that presents in your institution. And this is to avoid panic and undue stress. So kailangan meron na kayong policies in place in case you're able to detect a case of Mpox, you should at least know where to hold the patient, saan nyo siya papapuntahin, and you should at least know who to refer to. So kanino kayo hihingi ng tulong, so dapat meron kayong contact numbers. This should come in handy para doon kayo hihingi ng tulong and doon nyo papupuntahin yung patient in case suspected nga siya of having Mpox. So you should have some form of triage, meaning you should screen for patients entering your facility, or if not, you should at least make your employees aware of what symptoms to look for that are consistent with Mpox. So for healthcare facilities, for example, I try to advocate them to come up with their own Mpox pathway that is very specific to their current situation. And of course, lastly, when you talk about Mpox, since it's related to sexual transmission, you would have to be creative because sabi ko nga, sex is natural in humans. So whenever intimate contact is inevitable, think of ways, creative ways to minimize the risk of Mpox transmission. So again, the number one thing to do when you have the rash is to isolate yourself, avoid close contact, and consult a physician as much as possible. So in case it's really unavoidable yung close physical contact, do barrier protection, cover the lesions, and perform non-contact or remote sex at this time. You can also perform mutual masturbation without physical contact. And those are just other creative ways or some suggested creative ways on how to avoid Mpox at this time. So I would like to end my presentation para mas marami tayong time for Q&A. Thank you very much for your time. Once again, I'm Doc Des.
Thank you so much, Dr. Roman, for that very informative and insightful discussion. Actually, yun nga, when we were talking kanina, when we were preparing kanina, na-mention ko, I've experienced it also, Doc. And not me, yung Mpox, but we had this patient sa UHS na I'm not sure if kung ano na nangyari, but I think that patient was referred to RITM directly. So now I hope our audience has their questions ready, as we will now open the floor to your questions and thoughts. Dr. Roman, may we ask you to please turn on your camera for this part of the program. So again, for our on-site participants, feel free to share our inquiries. You can submit your questions to our facilitators wearing maroon, or you can raise your hand, introduce yourself, and direct your question to our speaker. For our online viewers, we'd love to hear from you too. Just introduce yourself and post your questions in the comment or chat box on your streaming platform, and we'll make sure they get answered. Okay, Doc, mukhang for now nagpe-prepare pa sila ng questions. Sa point of view, ako po muna, Doc Des, ang magtanong siguro. So, Doc,
Go ahead.
sa point of view sa community, for example, ako'y ordinaryong mamamayan at walang idea, saan po ako dapat unang pumunta? Should I go to barangay health station? Should I go to rural health unit? Or diretso po ba ako sa ER ng emergency room? Kasi I'm sure, lalo sa ating mga mamamayan na wala talagang idea, it would really cause fear. So, saan po kaya mas magandang dapat pumunta para sa amin for the future na mag-educate po kami in the community areas?
Most of the cases right now, they are very concentrated in the urban area. So halimbawa Manila and the other nearby provinces in the Philippines. So syempre in urban areas, Manila, RITM for example, yung access to these referral centers for Mpox, madali yan, di ba? So of course, you have RITM, you have PGH, you have East Avenue Medical Center, yung mga those institutions with dermatology training centers in the Visayas. I think you have SPMC and you have your Eastern Visayas Regional Medical Center and even Vicente Soto. Of course, these are DOH retained hospitals or even local government unit retained hospitals. They are very much aware on how to handle Mpox cases. But what we are trying to do sa RITM and even with PSMID and even DOH is to try to cascade the information to all healthcare facilities. Oo, so whether halimbawa sexually STI clinics yan or social hygiene clinics, they should be able to know how to recognize Mpox and kung ano yung referral system. So there have been identified referral centers, kung di man referral centers who can perform the biopsy, the swabbing of the lesions para they can be sent to the RITM as the National Reference Laboratory who can perform Mpox testing at this time. But to answer your question, at this time, yung mga dermatologists, they are very much aware on how to recognize and what to do when they have Mpox. The emergency rooms also, they are very much capable to isolate and assess and particularly refer these cases of Mpox locally and to their local epidemiology and surveillance units.
Thank you so much, Doc. Ayan na ang mga ating mga questions from chat and Zoom. So, Doc, ang tanong po, meron na po ba tayong preventive protocols in place travel-wise? Like, alam po natin from Africa ang cases, how do we monitor this in case may passengers from these places po, Doc?
Yeah, so kasama naman siya dun sa travel declaration, di ba? So that is something that's being watched out for. Have you been symptomatic the past 30 days and where have you traveled? Pero if you're going to ask if there are travel restrictions at this time, walang travel restrictions. Even the World Health Organization does not recommend any travel restriction. Kasi nga, when you consider the mode of transmission of Mpox, hindi naman siya respiratory or airborne, diba?
Yes.
It will really take close physical contact for a certain amount of time for that type of exposure to be really significant. So, ganun pa rin naman. So, ang important na screening na ginagawa at the ports of entry would be when you have fever or when you have lesions, then you approach yung mga Bureau of Quarantine personnel. Wherever you are, hindi lang naman sa Philippines yung screening at ports of entry.
Yes, Doc. Thank you po, Doc. There's another question po. Paano po kaya malilesen or mababawasan ang pagiging anxious or mauuna ang panic ng mga tao po?
Yeah, so number one, if you know what to do, if you know where to consult, and when you know the disease progression, then that's awareness. Actually, that's the first part of it. But really, it's prevention, di ba? And you know that when you avoid the high-risk activities that puts you at high risk of getting Mpox, then you know how it is prevented. Sabi ko nga sa inyo kanina, there's some form of stigma that's being attached to Mpox kasi it's being related to sexual transmission in nature, but really it's close physical contact. So the good news is, sabi ko nga, Mpox is not a difficult virus to kill. Yung usual na ano natin, yung usual na 70% alcohol natin, it's really very effective in killing the Mpox virus.
Mm.
So I think yung mga natutunan natin na public health measures, masking whenever you are symptomatic at this time, yung
Yes.
performance of the hand hygiene,
Mm-mm.
personal hygiene, siguro at this time kung tumaas pa yung cases natin, halimbawa mas maging prevalent siya in the community, yeah, maligo siguro after we expose ourselves to crowded areas, and basically that's it. And sooner or later I'm sure makakarating naman dito yung yung gamot, yung tecovirimat, and even the Mpox vaccine.
Yes, Doc. Doc, this is from Anonymous. I think this is from mga pet lovers. How about po sa hayop na alaga sa bahay? Marami po akong aso at pusa na kasama ko matulog sa kama. Nakakahawa rin po ba sa kanila?
Yes, yes, oo. So since it's a zoonotic disease, pwede ring mahawa yung other mammals. So when you read the DOH guidelines, for confirmed cases ng Mpox, kasama sa isolation. Kailangan hindi mo kasama yung mga pets mo dun sa area where you are isolating yourself. Kasi pwede talaga silang mahawa. And most of the time, the presentation would still be skin lesion, sa mga animals. But yeah, if to answer your question, nahawa sila. And for confirmed cases, even suspected cases, ihiwalay yung mga pets na yan until you recover. Usually it's after 21 days.
Ay, ang tagal, Doc.
It's matagal siya at this time, oo.
Apo.
Siyempre, improving kasi, so we want to err on the side of caution pa rin.
Yes, Doc. Doc, there's another question po. Sa level po ng community awareness, sa paano pong paraan kaya natin effectively ma-disseminate ito sa community? Saan tayo dapat unang mag-focus kung may wrong information on note, or not enough information sila? Tama ba? Or not?
There are different levels to it. Sabi ko nga sa inyo, iba-iba din naman yung risk ng tao eh. 'Di ba? There will be a group of people not to create stigma here, pero during the 2022 outbreak, yung outbreak in the European countries and in the American countries of the Clade 2, most of the people that were reported to have been affected are those who engage in high-risk sexual behavior. Oo, kasi nga, it will require close physical contact. So we want to target those individuals as well, di ba? So we want to talk to them, we want to talk to the community who engages in such activities. Oo, para makarating sa kanila yung message
Yes,
on prevention, but also early recognition and isolation. But we also do not forget the general population because pwede naman yang mag-overflow. So in terms of the Department of Health, for example, they are trying to reach out to the different stakeholders. So number one, to the population at risk, but also to the establishments, for example, di ba? I know that recently the DOH came up with recommendations in various commercial settings, and that would include minimization of risk sa mga spa, di ba?
Apo.
Yung sa mga spa business owners, yung mga massage business owners, there are ways of mitigating the risk. But yeah, what we want to emphasize here is we want to avoid the stigma that we attach impacts to certain groups of population. But at the same time, gusto nating makarating sa kanila yung tamang information. There are a lot of infographics already coming from DOH and even the Philippine Society for Microbiology and Infectious Diseases, or PSMID, and even yung RITM Facebook account. Ang daming mga infographics dyan on Mpox that you can use.
Yes, Doc. Thank you so much po, Doc. Doc, nag-follow up question po yung pet lover natin. Paano po kapag nahawa? Need din po ba ng vaccine sa kanila, yung dogs or cats?
So kapag
after?
nahawa ka, you don't need the vaccine. What you need is the antiviral. But I am not aware of antiviral use for animals at this
Yes.
time. The antivirals available, sabi ko nga kanina, it's for humans. And not for all. Kasi kung mild lang yung symptoms mo, you don't even have to receive the antiviral. Only for those na marami yung lesion, although only for those na bagsak yung immune system, yung mga AIDS patients natin, only for those with complications, yung merong hindi makakain, nagsusuka, and there's severe pain, only in those times na magsa-start tayo ng antiviral. But for all the rest, most of the time, it will heal on its own and they will only require supportive treatment.
Yes, Doc. Thank you so much, Doc. We've been thrilled by the flood of thought-provoking questions and enthusiastic participation. However, due to time constraint, we need to bring our open forum to a close. A big thank you to everyone for your active engagement at this point. It's time to show our appreciation to our wonderful speaker. I'd like to invite Dean Joanne Serrano to join us as we award the Certificate of Appreciation to our esteemed speaker. Allow me to read the citation. The University of the Philippines Open University Faculty of Management and Development Studies presents this Certificate of Appreciation to Dr. Arthur Desin Roman for serving as speaker during the Let's Talk It Over Mpox Uncovered Safeguarding Health, Preventing Outbreaks, held on 14 November 2024 at the Audiovisual Room, UP Open University, Los Baños, Laguna. So given this 14th day of November 2024 at UP Open University, Los Baños, Laguna, signed Joanne V. Serrano, the Dean. Thank you once again for being, thank you. Meron na po ba? Or... Okay. So thank you once again for being here, and let's give a round of applause to our speaker. Thank you so much, Dean and Dr. Ramon. So to formally close our program, we will be hearing a pre-recorded video from Dr. Myra Oruga, Program Chair of the Diploma in Master of International Health.
Ladies and gentlemen, esteemed speaker, Dr. Arthur Desi Roman, and participants, in behalf of our Dean, Dr. Joanne Serrano, I would like to thank you all for attending this insightful webinar titled Mpox Uncovered, Safeguarding Health, Preventing Outbreaks. I would like to express my sincere gratitude to everyone who has joined us today. Your active participation, thoughtful questions, and shared experiences have contributed to a truly enriching discussion. We have learned about the importance of vigilance in monitoring and responding to Mpox, the strategies for safeguarding public health, and how we can all play a part in preventing future outbreaks. The knowledge shared today will undoubtedly strengthen our collective capacity to protect communities and ensure that we are better prepared to address emerging infectious threats. Let us take the insights and actionable steps from today's session and apply them in our work, our communities, in our personal lives to foster a healthier, safer future for all. Thank you to our distinguished speaker, Dr. Roman, for his expertise, and to all of you for your engagement. We look forward to continuing this vital conversation and working together towards a more resilient health system. Stay safe, stay informed, and let's continue safeguarding health and preventing outbreaks.
We've reached the end of our program. We appreciate everyone's participation and enthusiasm today. Before we wrap up, we kindly ask everyone to take a moment to complete our short event evaluation form. You can access it using the QR code and link that are currently flashed on the screen. Your feedback is invaluable to us and helps improve our future events. Please note that you'll receive an e-certificate once you've completed the evaluation form. It may take 5 to 10 business days for you to receive it. On behalf of FMDS, we want to extend our heartfelt thanks to everyone who joined us live and virtually today. We truly appreciate your participation. Announce ko lang din po, next LTIO on December 11, 2024, HR of the Future. Once again, I am Assistant Professor Regine Carla Bagalanon, and this has been the FMDS UPOU for the LTIO Mpox Uncovered Safeguarding Health, preventing outbreaks. Please stay tuned to our social media pages for the next episodes of LTIO. Yun na nga, as mentioned, December 11, 2024. Future events of FMDS. So we have some exciting content coming up that you don't want to miss. So maraming salamat po sa ating lahat.